How I approach a hamstring pull. So what I do, I start with the glute and then the hamstring and then towards the calf and the ankle. And then don't forget, most of the time when you pull a hamstring, it's not because you pulled it because of the hamstring. It comes from the flexor and the quad. So after I'm done releasing the hamstring, glute, and calf, I will turn my patient over and do her flexor, quad. And usually that's what causes a hamstring pull. So let me start with her. So right now I'm gonna start with her hip rotators. So I'll put some pressure on the piriformis muscle and I grab the leg by the ankle here and I rotate until you feel the action and the muscle piriformis working. You do this until you feel like the muscle in the glute releases. If it's really tight, also you could go with the elbow. You could dig in with the elbow until you feel the muscle let go. Oh, there it goes. And from there I go to the head of the hamstring attachment muscles, right on the bottom of the glute in the greater trochanter, right here. I put pressure with my elbow on the attachment of the hamstring until you feel it let go. Once you feel it let go, you go to the outside one, the posterior one. Then once you start feeling it loosen up, you got some lotion, and then you start doing some sweeps, effleurage with a little pressure there to let the tissue go, get the blood rolling in there. Once you feel and see the blood rising to the surface of the skin, is you get the blood flowing to the tissue. You go soft knuckle, palm, and then you grab the ankle again. You put pressure with your thumb or your knuckles on the head of the femur muscle here. And the hamstring. You stretch and pull. This is the myofascial release. Right here. Oh, there it goes. The other way I do it, I put my palm into the attachment of the hamstring right here, and then just pull back down. You'll feel the release and you just wiggle the muscle and see if you feel any tension. If you don't, then you go down to the calf. You get some more lotion and then you start sweeping the calf also to release the back of the knee. You pick up the leg and then you start sweeping it down. I also do is I grab the pressure here and squeeze down and pull the foot down. You stretch the Achilles tendon with the calf muscles here, the gastrocs. It might be a little tender for the patient, so just follow up with them. Relax. If they're tensing up, it's most likely because they feel a lot of pain. Okay. You put your thumb on the belly of the gastroc right here. You twist the ankle inward, and then when you go down, you pull it outward. So you get the rotation and see how they release right there. And to get the peroneals or the tibialis, I go through the front of the shin bone here, the tibialis. I put my thumb right here where the attachment or where the tendons are, and then just pull the foot upward until you feel a pop. There you go. The muscle just released right there. And now you can check with the tissue, wiggle a little bit, and you see how loose that is. That's pretty much you got the tissue to let go. Make sure you let go of all the tightness and the knots before you turn your patient over. There Okay, I just turned over my client face up now, supine. Now I'm gonna work her quad and her flexors. That's the antagonist muscles of your hamstrings, and we need to release those and to balance that leg, to release all the hip joint area. Let's get some lotion. Let's start sweeping, warming up the tissue. Yeah, she has a little pressure right here, tension right in here in the front of the leg, right here on the quad. There we go. Just keep on warming up the tissue. Just push forward, get the tissue warm up. You see the tip, you're gonna start feeling the tissue letting go. You feel the blood in the area. See how the leg is already starting red? That's good. So it's coming from the attachments where the flexors up here. That's where I feel more of the tension on her leg right now. Okay, so I'm gonna go back up here where the flexor is at. So I'll put my fingers in there. If it's a really tight one, you can put your elbow, but to the comfort of your patient. You can have her take a big deep breath. Let go of the air, let go of the leg. There you go, there it goes. See, just like it goes. So when it's good, now we go to the quad right in here. You can put the elbow to the patient's tolerance. You don't have to go too deep. You want your client to come back. Muscle just is starting to let go now. You'll feel that the muscle release when you put the pressure. This is what I say. I usually use acupressure or trigger point. This is where I use it where the muscle's really tight. And there it goes. You just let go. You'll see how soft that muscle got. And it'll release from here. Now I'm gonna go to the IT band right in here. This is one of the trigger points for the IT band. I usually use this to get the side of the leg to let go. So what I do, I grab the knee from right here, and I'll put my elbow right in the trigger point right there, and I'll rotate the leg up and down. Yes. And there we go. So you just let go. The muscle just let go. So that's how I approach a hamstring pull. I usually, like I said, you have to do the quad and the flexor because it's all the hip girdle. You have to let go of all the muscles, the glutes, the quad, the hamstring. So that all these muscles, you have to release them for they go all balance out and your leg could be working properly and the tissue will be fine. And it won't put no more pressure on her knee or on her hip also. Even the low back, because all those muscles will cause pain in your low back also. Thank you for watching my video. I'll catch you next time. God bless and have a nice day.